If there's one concept we can take away from economics, it's cause and effect. For Dee Hunt, the cause was bad news from her dentist. The effect, rising before dawn to get into the back of a van in a department store parking lot.
My estimate on implants in Scottsdale was $10,000. Now, I've been told that they're around $1,200 down here, so you can do the math.
For many people, it's no laughing matter. A quarter of the U.S. population, more than 45 million adults, don't have dental insurance. That's why Dee and 3 other women called up Dayo Dental, the company that's driving them 200 miles for a cheaper alternative.
We've brought that affordable and trusted dentistry to Americans.
Yes.
Their destination is a dental clinic that seems, at first, a lot like any other.
The facilities are clean, the people are very friendly.
I might say that the ones in Phoenix might be more high-tech, There's a bigger flat-screen TV in the office.
The flat-screen TV here is still pretty big, but there is one other major difference. Dr. Rubio's clinic is in the northern corner of Mexico that shares a border with both California and Arizona. It's a town that occupies about 1 square mile.
Many people call it like a capital of dentistry.
It goes by other names: Vicente Guerrero, Molar City, or most commonly, Los Algodones.
Dentists start coming over, first 3, 4 dentists, and then 5, and then 10.
And today it's more than 300. They say there are more dentists here per square foot than anywhere else in the world.
It's common sense. If you cannot afford something and where you're at, you're gonna look for a different option. And for some people, we are that option.
The cause: rising healthcare costs across the U.S. and a shortage of dentists. In Arizona alone, the U.S. Department of Health and Human Services says there are 50 areas that don't have enough dental professionals. In the past 25 years, this little town has seen the effect.
90% of the patients come from other countries.
Looking around town, you might agree, but dental professionals in the U.S. caution those searching for cheap healthcare abroad.
Yes, they can probably provide those services at a significantly lower cost, but it is catch as catch can in terms of making certain that the person who is providing those services has been adequately trained, adequately tested.
So we contract with top-ranking dentists in Mexico. We established a set of guidelines that would sort of mirror Americanized dentistry in terms of safety compliance, in terms of services.
The risks are clear, but after her first time crossing the border for dental care, Cherise says the trip was worth it.
I'm going to talk to my insurance company. I'm going to do a lot of digging and see what the best option is, but I think I'll be back to Mexico.
Meanwhile, it's expected that the ratio of dentists to patients will keep falling in the U.S., and prices will keep going up. And here, in the dental capital of the world, they're betting on cause and effect. In Los Algodones, Dan Neely.